Hello, everyone. This is your host, Susan Rosen, and my special guest today is Dr. Melina Jampolis. Am I saying that right? Oh, good.
Perfect.
Good. I didn't want to murder it like, And is it okay if I just call you Melina?
Of course.
Okay. Melina is an MD. She is an internist and board certified physician nutrition specialist, which looks like it's a fairly small group of people. What is it?
Yeah,
Only
unfortunately.
Yeah,
less than a few hundred of us in the country.
wow. And you are also a frequent media contributor. And I was also very impressed with a lot of the shows that you've been on.
Thank you.
And I'm just going to let you kind of introduce yourself as well, and anything additionally that you'd like to add to that.
Yeah, sure. Thank you. Thank you for having me. Well, first of all, I am trained as an internist. And after, 7 years of training, 6 months into practicing internal medicine, I just decided that was not what I wanted to do. I did not want to make the pharmaceutical companies millions of dollars putting people on drugs for high blood pressure, high cholesterol, diabetes, and have 10 minutes to speak with the patients about anything else. So, but at that time, that was back in, actually 1999. And there weren't a lot of avenues for physicians to train in nutrition, but I really felt like that was the key. Weight management and nutrition that could, rather than, putting Band-Aids on things, I really wanted to treat it more effectively. So I kind of embarked on this journey of self-study initially and just going to conferences and reading textbooks. And then in 2004, I became a board certified physician nutrition specialist, which was a relatively new criteria. And that's what I've been doing ever since. Of course, I incorporate my internal medicine training to what I do, but my emphasis is on nutrition for disease prevention, for weight management, for disease treatment in some cases. Not that I eschew, traditional medicine, but I always bring into nutrition. I always bring nutrition into everything. And it still astounds me that this is not a more integral part of medicine, because I believe that every disease from head to toe has a nutrition component, where either causality or potential benefit from eating some type of food substance. So, I've written 5 books. I had a TV series on Discovery called Fit TV's Diet Doctor. I've worked for CNN as a contributor since 2007. I've recently joined the Forbes Health Advisory Board. I do a lot of mainstream TV, like Live with Kelly and Ryan and the doctors, really trying to get good science across in a way where people can really understand it and implement it into their lives. So that's just me. And I'm an old mom. I'm 51 years old and have a 7-year-old and an 11-year-old, boys both. So I am busy and tired a lot.
and totally watching your nutrition in order to keep all of that under control, right?
Absolutely. Yeah. I mean, and I'll tell you, it wasn't easy during COVID. At the beginning, I really had to listen to my own advice. Often it was just such a crazy time, but I think now more important than ever, I think that's one of the positives about COVID, is that people are thinking a little bit more now how they're taking care of their body and supporting healthy immune function and minimizing the risk of maybe obesity and that sort of thing. So it's one of the few silver linings of the pandemic, that's for sure. But I think people have started paying a little bit more attention, which I truly appreciate.
Yes, absolutely. Yeah, because I think that so many people were just rush. They were so busy. They wanted to have every minute of their day filled, before COVID. And I think that's the big thing that changed for everybody, was that all of a sudden it was like, oh my God, I can't go out for dinner. I can't go out here. I can't go out there. And I agree with you. I think it was a very positive thing in that respect.
Hmm.
I think it drove a lot of people crazy
Of
in a lot
course.
of
Yeah.
different ways.
Yes.
But overall, you know, I think people just became a little more aware of their lives.
Yeah, definitely. And became more present. And
Yes.
even, you know, I like the idea of cooking more at home. Certainly that has, you know, incredible health benefits, less on the run. You know, there's pros and cons. You're at home, so you're closer to the kitchen. And if you use it as a 24-hour, you know, food bank.
Yes. Yeah.
But I think the idea of cooking from home and making
Mm.
more foods from scratch and spending more time with your family. And when we were alive,
Yep.
being able to get out more, and even developing a home exercise program to kind of excuse proof exercise. I
Yeah.
think I know for me, I bought a spinning bike, not a Peloton early on.
Yeah.
And, you know, it was a game changer for me because I didn't have to plan and schedule my exercise and make sure that I made it to the class. I could just hop on whenever I had a free 30 minutes. And it
Mhm.
really helped me a lot in my fitness, protocol that I do at home.
Yeah. Oh no, absolutely. Yeah. We bought my husband and I, a bench and some weights and another kind of bench kind of
Mm-hmm.
thing as well. So yeah. And we walk every day when we can. It's pouring rain here right now, but excuse me. I wanted to ask you, so since this podcast is kind of aimed for people over 50, and I picked that number just because that's when so many things about our physiology and our bodies start to change. You know, women start dealing with menopause, men start dealing with their own version of that. What is it, andropause? And there's just, you know, especially nutrition, there are things that we need more of. We probably don't need quite as many calories because we're not burning it as fast as we used to, you know, all of those sorts of things. So I was just wondering if you would, you know, talk a little bit about that and give the audience some maybe pointers or things to watch out for and things to think about.
Yeah. Well, I mean, that's it, as at 51, that's, obviously I'm in that
Yep.
space. So it's definitely something that I think a lot about personally. And, my latest book, which is called Spice Up, Live Long, is really focused on what we can do to not only live longer, but increase our health span. I think,
Mm,
that's it's not just about living, their lifespan. The health span is very
yeah,
important. And so,
yeah.
there are definitely some changes that take place. I mean, I think more so for women, I am
Mm.
certainly in the midst of the, peri or menopausal, and it's, my body is just, I mean, I don't even know what to expect from day to day. So, but I think in general, and a lot of what I focus on in the book is diseases of aging. So
Mm.
we know that heart disease and cancer and diabetes and osteoporosis and all these things start increasing in prevalence as we age. So I think I focus very much on disease prevention. And I think even with men, it probably starts even earlier, like probably
Mm.
closer to 40, but certainly starts accelerating at
Uh-huh.
50 with age-related muscle loss. I mean, I think that's one of the things that we honestly have the most control over, that, you lose up to 3% of your muscle mass per decade. But
Yeah.
I think that is a really, certainly it's a combination of the aging process. But I think a lot of it is just that we become more sedentary and we push our body less, particularly women. We're not as physical as we were, say, 50 years ago.
Mhm.
And so, and I think from a dietary standpoint, research has definitely shown that most people benefit from slightly more protein than the
Yeah.
recommended daily allowance. I think the quality of protein is very important because our ability to digest it and absorbs it decreases somewhat with age. And also the more high quality protein is able to trigger something called muscle protein synthesis, muscle building more effectively. So I think that's important. We also know that as you get older, it's not just how much protein you eat in a day, it actually is beneficial to spread it out throughout the day. So I think that's something that I think changes a little bit, is that I really encourage my patients to start their day with a protein-based breakfast, whether it's eggs or dairy, or if they're vegetarian, a protein shake, a soy, a plant-based protein shake, and to make sure that they're getting protein spread throughout the day to optimize muscle building and muscle retention. Not that I'm trying to get people to be bodybuilders, but maintaining your muscle, which will not only decrease your risk of falling, which is, something that becomes more of a risk as we get older and breaking bones, but also maintains your metabolism, because our lean body mass is a pretty good contributor to our total metabolic rate. And so the more muscle you can maintain, the more breathing room you have with nutrition. And like, for me, that's very important. I have a sweet tooth, and I like wine. So I want to make sure that I have extra calories in the day, and maintaining the lean body mass can really help with that. So, those are a couple of things. I think, cancer incidence obviously goes up. So, that's why I wrote one of the things in the latest book, about spices. I think herbs and spices have tremendous antioxidant properties. They fight inflammation, which can cause diseases from head to toe. And many of them can actually interfere with the cancer initiation and propagation process. So, those are just a few things that I talk a lot. I think it's important, as you said, because you have to cut calories. I think you have to increase the nutrient density of your diet, not the calorie density. So you don't have to be perfect, but you have to make sure that you have nutrient dense foods, because if you're eating fewer calories, you may not get all the vitamins and minerals you need in a day if you're not eating, nutritious foods in addition to some indulgences.
Yeah. No, and that makes a lot of sense. Is there, no, that's another problem. Now I just forgot what I was going to ask you. No, I know what I was also, talk a little bit about the relationship of protein with our bones.
Yeah, I mean, I think that's something, that's a great point. I mean, people think of calcium as being really the only thing that is relevant to bone density. But certainly, vitamin D certainly is very important, and the ability to convert vitamin D in your skin from sunlight exposure diminishes with aging. So that is something that I often recommend supplementing after 50, particularly if you live in a northern latitude where the UV exposure is not going to be as potent. But protein also for bone density is very important, as is vitamin K. There's a lot of different nutrients that we know, and magnesium that works synergistically. We get magnesium from leafy greens and beans and nuts. So, really, as corny as it sounds, having a balanced diet, that's why I get so nervous about these kind of fad diets or aggressive elimination diets as the population ages, because then you're much more likely to not get enough of a critical nutrient, for disease prevention. Fiber is very important for the digestive tract, and these low carb diets can also often be deficient in fiber. Low fat diets deficient in healthy fats that are important for, creating hormones, for brain chemistry. Omega-3 fatty acids for brain health and reducing inflammation can help decrease your risk of, age-related cognitive decline. So, anytime you cut obviously, like for you, you cut dairy because you have a sensitivity to it, you mentioned. And so, it's how can we introduce different types of good protein and calcium from vegetables, and making sure, or making sure that you get a supplement to make sure you maintain bone density. So, But quality protein is an important, and that becomes more challenging with a vegan diet, obviously. So in those patients, I'm often suggesting some sort of protein shake, because
Mm,
it is very hard to get like a gram per kilogram, about about a half a gram per pound of your ideal weight in
wow.
protein if you're on a vegan diet, because then you got to eat a lot of nuts and a lot of beans and things that really may pack on the pounds, and then you become skinny fat. So you're actually overweight but don't
Ah,
have adequate muscle. So, I think paying a little bit
yeah.
more, obviously a more plant-based diet is highly beneficial in many circumstances, but I think adequate protein is also very
Hmm.
important to the equation. So, fish, I think being a pescatarian is a better idea than a
Yeah.
vegetarian, which is a better idea than being vegan if you're over 50.
Yeah. No, that makes a lot of sense. That makes a lot of sense. And when you're talking about like vitamin D and omega 3s and omega 6s are the other ones, right, that are out there, and people get confused which one is which. Um, what about some of the things where if you have, well, where you get too much through supplements, right? Because so many people think, oh yeah, if this much is good, then twice that amount must be better, right?
Right. Yeah. And just because it's natural that it must be harmless. I mean, I
Thank you.
think,
Yes.
that's something too that you have to be careful of, particularly as you get older and you may be on medications. I mean, I
Mm,
think
mm-hmm.
there's drug supplement interactions, there's drug food interaction, there's supplement interaction. So, just taking something because your neighbor said to, or your acupuncturist told you, or your personal trainer, and then
Right.
I think you need to be careful. And is there, it's complicated, but you do, because the medical system, I don't think is as equipped to deal with these questions. You have to do your homework, talk to your pharmacist, go online,
Mhm.
make sure, and yes, certainly mega doses of anything are probably going to be detrimental at some level. I mean, even vitamin D, there's
Yeah.
evidence of that. So, I think one of the things that is, really important to understand is that we're talking about balance in the body.
Mhm.
So,
Mhm.
if you take too much zinc, copper absorption can be affected, or things like,
Yeah.
even
Yeah.
with hormones, we're looking for balance. So, when you megadose on things, you're probably going to be throwing something off at the cellular level, which, may have long-term or even
Mhm.
short-term consequences, so
Right.
definitely you don't want to be deficient. And I think, the medical community is probably not focused enough on nutrient
Mm.
deficiencies, particularly things like magnesium, which is involved in over 300 chemical reactions in the body, and yet 70% of Americans are deficient. But so you do have to kind of take it upon yourself. And then of course, antioxidants, people don't pay a lot of attention, polyphenols, probiotics, prebiotics, everything works synergistically in the body. It's
Yeah.
not just one super nutrient that does everything and makes you perfectly healthy.
Yeah. Yeah. Well, and the other thing, I mean, magnesium is a perfect example. There's like how many different kinds of magnesium out there
Right.
in supplements? It's
Yeah,
like, well,
there's quite a few with
and they're
different
not
levels of
all
absorption.
not all the same, right?
Right.
They help with different things, or you need to take more because it's this kind of magnesium, or
Right.
you need to combine it, or you need to take it when you're not taking something else.
Yeah.
I mean, no wonder people just get confused, throw their hands up and don't do anything.
Absolutely. No, I totally agree with you. And I don't blame them. And I mean, it always amazes me too when people come into my office with just like grocery bags of supplements, and they line them up, and I'm like, why are you taking, they don't even remember why they're taking half of what they're taking. And I'm like, okay, did you notice that this and this are almost exactly the same? And you're like that. Yeah. So you have to be smart about it.
Yeah.
Just because something is natural doesn't mean that it's, like you said, totally, that you can take unlimited and more is better. It is, the body is really, and that's why I always try for food first. I mean, that may not
Yes.
always be possible because our our soil quality has deteriorated so much over the last 50, 60 years.
Yeah.
And our, ultra processed foods in our diet that are stripped of critical nutrients.
Right.
So I think even if you eat a perfect diet, I'm in the camp of, I take a basic senior, I hate saying that, but I take, basic senior multivitamin for women
Uh-huh.
over 50, and,
Uh-huh.
and I have to tell you, it actually, I started it over the summer because I noticed that my nails weren't growing as well as
Uh-huh.
and it's totally changed that. So I must have been deficient in something. And
Wow.
that's
Yeah.
the other thing about with medicine, because tests for micronutrients are less in mainstream medicine. It's not really widely accepted because they haven't been as clinically validated, and it's complicated. Like what's in your bloodstream may not be what's relevant at the cell level or even in the intramuscular level. So what are we really testing? So, it's not so easy with, as a doctor, you can't just send you to the lab. Like with vitamin D, I can send you to the lab and say, you're deficient. I calculate your dose based on how much you're deficient and how much you weigh. And then for something like magnesium, that's not even possible. You need functional magnesium, and that's not a accepted test. So I always tell patients, start with diet first, and then we kind of supplement as needed if necessary,
Yeah.
so,
Yeah.
but it's complicated. And unfortunately, there's not too many doctors that do it. It's left to
Yeah.
dietitians, and, dietitians, it's out of pocket. Insurance doesn't cover it unless you're diabetic or have kidney failure. So something I feel like really needs to change in our
Yeah.
whole, and I've been working
I
very
agree.
hard as part of the National Board of Physician Nutrition
Uh-huh.
Specialists to
Uh-huh.
try to evoke some of those changes, but it's an uphill battle. I tell
And
you,
it's
people
slow.
it's slow, and, people are conservative and doctors are slow to change and creatures of habit. And, it's
Well,
frustrating.
and as you said, a lot of it is dictated by insurance and or where they work, right?
Right.
And I know, even just for myself, I'm 66. And the last time I went in to get my yearly blood test,
Yeah.
right, I got it back. And the only thing she had tested for was cholesterol. And there was one other thing, I can't even remember what it was. And I'm like, excuse me? I'm 66 years old and that's all you're testing for? What's wrong with this picture?
Yeah. Yeah, no, and a
So,
lot of that is,
and she's
driven
like,
by insurance
yeah,
companies and
yep,
government,
yep,
and even physician training. I
yes,
mean, it is hard. I tell you, I've been out, I graduated medical school in 1996, and,
hmm,
to keep up with everything with the latest
I'm
advanced,
sure.
it's hard. You really have to be your own advocate in healthcare
Hmm.
these days,
Yes.
which is challenging for somebody with no health background. I mean, to
Hmm.
go into
Yeah.
your doctor's office and ask questions and, and be treated with respect then by the doctor, it just unfortunately is not going to happen that often. Or maybe your doctor just doesn't know. They certainly don't know about food most of the time. So,
Yeah.
or supplements, which I think are part of that. So,
Hmm. Hmm.
and then we have, on the flip side, we have, there are some integrative doctors that I believe take it too far, and it's too much unfounded science and too many supplements. So, I feel like I'm caught in the middle where sometimes I'm looking at these tests from, functional medicine doctors, and I don't know what they mean. I don't know whether they're actually legitimate tests,
Yeah.
but it
Yeah.
seems like, and the patient, when they have to pay $3,000 in out-of-pocket expenses and then buy
Wow.
$300 a month of supplements, I don't know. That's not good medicine to me.
Yeah. That's a
I just,
business.
it's a business, and it's hard, but they are listening to the patient. This new field of functional medicine and more integrative, they sit and they listen to the patient
Yeah.
because because the patient is paying cash. So unlike insurance companies or managed care, they give you 5 minutes. I mean, so, it's hard. I think the system is broken, and
Yeah. I agree.
I hope that it slowly changes, because I think our health is, at stake, and our children's health, and, don't even get me started on like childhood obesity, and that, that's been really, really discouraging during the pandemic. And I'm praying that that reverses as we, start getting out of it.
Yeah, that's that's difficult, and I can appreciate that. I mean, I was a fat kid, and I was lucky. When I was in graduate school, I went to UC Berkeley, and my doctor, weighed me and all that kind of stuff, and said, at school, it was the school doctor, and at that point, she said to me, she said, you know what? You don't lose the weight now, you'll be fighting this the rest of your life.
Wow. She was ahead of her time.
You better believe it. I mean, because we're talking about mid 1970s.
Yeah.
Okay. And so I did. I went on a calorie diet kind of thing. But it made me aware of what was in the different foods. And I did. I lost I don't even remember what it was, like 30 pounds or something.
Fabulous.
And and I've, knock on wood, kept it off.
Yeah.
But, I was lucky. I was very lucky that she, that was who I was talking to.
Absolutely. Yeah, no, I struggled with weight, and I was younger too, after a high school, knee injury playing soccer. And I didn't know anything about nutrition. So I just kept eating like I did when I was playing soccer 3 hours a day, and gained, 30 pounds during puberty, like when I was 15 or so. And I mean, I didn't actually get the weight off. Nobody ever told me, that it was relevant. I didn't look, I'm a pretty big bone person, so I didn't look really that big. And it wasn't until after medical school that I started figuring things out and trying to learn. And I mean, that was part of my journey too. So I think it makes me a better nutrition and weight loss doctor, because I truly understand where they're coming from. I mean, I've never been morbidly obese, but I have to pay attention. And so I understand that, I understand that it's not easy. I'm not a great cook. That's another little dirty secret. No, I've written 5 books, and they all have like recipes in them, and I never make any of them. I have like 3. I hire chefs, to do all this stuff for me. And, on my new podcast, Practically Healthy, I'm talking about cooking with people, and I'm like, okay, let's make it really easy for me, because I am just not like, that great in the kitchen. So, I'm a realist when it comes to all this stuff. And I think, that's important to delivering information that is actionable for people, and that they feel isn't overwhelming or intimidating.
Right. Oh no, I totally understand that. I totally agree. It's like you watch some of these shows, and they've got somebody came on and did their favorite recipe, and it's like, yeah, it looks good. Somebody wants to come into my house and cook it for me, because this ain't happening if I'm the only one there.
Exactly. No, I know. If it has more than 10 ingredients, I'm just like, I
How
can't.
About 5?
Yeah, I know 5 is better. But ever since I've written the spice books, I realized that you can have like 5 different spices, just a little bit, that adds extraordinary flavor and health benefits at the same time. So I've bumped up. It used to be 5. I used to be with you, like it's 5 or less. But now I'm like, okay, I can do a little cumin and oregano and turmeric, and that's not hard, because I've got the spices on my counter, and I could just bake it in. Especially when you really understand the health benefits, because I've spent 7 years studying the health benefits of herbs and spices, and it's so exciting. I'll send you a copy of my book, my latest book.
I would love that.
Yeah, you're gonna love it. It like inspires you to just even try, even if you just add one thing to your eggs or something, I think you'll be inspired to do it. It inspired me. So it's kind of fun when your own work inspires you,
Oh, absolutely. No, that's great. I would say probably 5 out of 7 nights of the week we have salad. He makes his own, I make my own.
Really?
We can do it at our own time.
Yeah.
Yeah. Oh yeah. No, he's great. He was a single father for a long time, so
Got it.
he learned how to cook.
Good. So you can do an easy like balsamic vinaigrette and just add fresh or dried herbs, and boom, you've amped up
Oh
the health
yeah.
benefits like that.
Oh no, that's great. That's great. Oh, I'll look forward to getting that. Oh boy. Something a
Lots
little
of good stuff.
different.
Yeah. And I talk,
Yeah.
on the new podcast too.
Mhm.
It's called Practically
Yeah.
Healthy by Dr. Melina. So I
Uh-huh.
really get into, a lot of practical things
Yeah.
that you can do, no matter what your age is, from a fitness standpoint, even from a mind standpoint. We've had a lot of really, the last guest I just had on, you would love. She wrote the book, French Women Don't Get Fat. And she's in her
Ah.
70s.
Oh my God.
And
Yeah.
she's still like, she was the CEO of Veuve Clicquot. So like she drinks champagne almost every day. She loves chocolate, bread. She walks everywhere. She's very inspiring, so I really try to bring on inspiring
Yeah.
guests of any age, to talk, because I think everybody's journey is individual, and I think
Mhm.
you can be inspired by different people in different ways. So that's been the fun part of doing this podcast too.
Yeah.
As you know, I mean, you've been doing yours for 3 years, and
Yeah.
I just started mine like 6 weeks ago, and it's been fun so far, just getting to really get to know people, and
Yeah.
everybody has some wisdom on some level, if you give them the chance to
Mhm.
communicate effectively. So
Mhm.
I'm
Oh
sure you've
yeah.
had the same experience over the years with your podcast. It's a lot of fun.
Yes. Yes, absolutely. And it's interesting because it's only been probably the last year and a half, maybe a little more, that I actually started having people on.
Oh, wow,
Before
really?
that, it was always just me. It was things that I had found they were healthy tips,
Mm-hmm.
right? And so, sometimes they were 10 minutes, sometimes they were 20 minutes, but that was about it. So it's now I kind of alternate
Yeah.
each day. But yeah, I'm just today actually going to be posting it's number 130.
Wow.
Yeah, I know.
Congratulations.
It's like, really? Have I really been doing it that long? Oh my God. But it is. As you say, I meet some really interesting people like you.
Thank you. I appreciate it.
Yeah. Let's talk about one other area,
Mhm.
and that's brain function, brain fog, as you get older,
Yeah.
and the things to watch for, not just as you get older, but before you get to that point. What are the things that are really important, like getting enough sleep,
Yeah, I
for
mean,
instance?
certainly that's definitely important. I struggle the
Yeah.
most with that one.
Yeah, so do I.
I'm not gonna lie, but I think reducing inflammation in your body,
Hmm.
even in middle age. So if you tend to carry your weight more around your midsection, the so-called belly fat, if you're more apple shaped, that
Hmm.
triggers more inflammation in the body. And we know now that over time, that inflammation can be damaging to the brain, can impair hormones in the brain, specifically one called BDNF. So you really want to eat an anti-inflammatory diet. That's very important.
Hmm.
You want to make sure that you have adequate, then there is a diet called the MIND diet, which was
Yes,
created by a professor at Tufts,
yep.
which I'm a big fan of. I actually reviewed the diet for Forbes, and I find it components of it quite
Yeah.
robust. So having plenty of omega-3 fatty acids and leafy greens and not too much sugar, and a glass of wine is probably okay. And, adequate fiber and that sort of thing. Definitely the omega-3s are good for mood, antioxidants, herbs and spices. Again, turmeric is involved in over 50 different protective processes in the brain. It's a very powerful anti-inflammatory spice. Strongly recommend incorporating that into your diet on a regular basis. Blueberries actually help stimulate nerve connections in the brain. Thyme helps actually with short-term memory in adults. There's been clinically proven to do so. So the quality of your diet, in addition to getting regular exercise and trying to minimize belly fat, I think all of those things can really add up, along with lifestyle factors, as you say, adequate sleep, stress management, using your brain, challenging yourself intellectually, community, connection. There's a lot that goes into optimizing brain health as we age. You know, and I really think even if you have a strong family history of Alzheimer's or something like that, dementia, that there's a lot that you can do to potentially minimize your risk of those things. And the sooner you start, the better, because, you know, most people aren't even aware of these, you know, subacute decreases in brain function that start happening around our age. And some of it is normal, the word finding, which I'm always struggling with as well. You know, but
big for me.
So, but I really believe that you can have your choices in life can have a profound impact on that.
So is it, out of curiosity, is it actually possible to get enough turmeric just by adding spices to get that? Because it's what, curcumoids or whatever it is that
I mean,
are in there?
you know, it's a great question. I mean, in you know, the short answer is we don't really know, but, you know, having like, you know, a quarter to a half a teaspoon, making sure that you combine it like with a little bit of black pepper, which increases the bioavailability by 2000%. And then also with fat. So having olive oil or nuts and seeds, that triad really improves the absorption. And some people theorize that that's why the population of northern India has 4 times less Alzheimer's disease, is because they naturally include turmeric and black pepper and oil in all of their curries. So, you know, food for thought. We don't know for sure. It's hard to do those studies where we're really doing diet intervention studies with something like a spice. But I think it's promising. And I think we can look at observational studies where we observe populations and really learn a lot about that.
I just was gonna, what's I'm doing here? Sorry, thing came up on my screen. I just was going to point out that I think it's very interesting that when, like you were saying with the Indian population, with the turmeric, if you look historically at people and how they developed their food habits and look back far enough, right? It's so amazing that humans developed and these ways to eat and things to eat that work synergistically together and that help with certain things. And now that we're all connected and we're all out there in the world and we've gotten away from all of these things, right? We don't listen to our bodies particularly.
We don't grow our own food. I mean, you have,
you
know, strawberries year round, tomatoes year round. No, we don't have room for gardens. You know, we need to go back to that a little bit. I think it would make a big difference. I mean, my third book is actually called it was the worst performing book, but it was called The Calendar Diet. And it really was about eating seasonally. And I just think that concept is so foreign to Americans in particular. That's something that the French Women Don't Get Fat author and I actually discussed, because that's so French. They go to the market regularly. They buy what's in season. You know, they're not eating, she's not eating tomatoes in the winter. She thinks they taste like cardboard.
They do.
And when she brought that to my attention, I'm like, oh my God, you're right. This tastes terrible. Like, what am I doing? But Americans, we just like don't care. I do love
or we
to have
fly it in
blueberries
from
year
somewhere
round,
else, right?
Huh?
We fly it in from somewhere else. Right. I mean, you know, I'm buying blueberries that are coming from Peru.
Right. I do love that though. I still do those because they're too good for us, and I love it. That's like nature's.
I know. No. I've got them in the refrigerator. Believe me.
Yeah, me too.
Costco carries them year round.
Yeah.
Oh, Well, I should let you go. I know you've got a busy schedule,
Yes, thank you.
and I really very much appreciate you coming on the podcast. And
Thank you so much. And yeah, send me your address. I'm going to send you a copy of my book. And if you
Okay.
want to give one away to your listeners, I can send you two. I don't know if you do stuff like that, but I'm happy to
It's a good
share
idea.
the love.
Yeah. I can do that right now. I'm trying to give away coaching sessions because I also do coaching.
Wonderful.
So
That's fantastic.
yeah. And yeah, so let me say that even though you are a registered doctor, we are not giving away medical advice on
No.
this podcast. And so if you're having any kind of an issue, please call your own doctor, go to the emergency room, whatever is appropriate for what you need to do. And with all that said, I will see all of you next week.